All right, welcome to our virtual discussion on COVID-19 vaccine. My name is Luca Lorenzi, and I'm a sophomore at Fresno State majoring in public relations, and I'll be our moderator for today's event. We have some amazing panelists with us who will provide an overview of the vaccine, help dispel misinformation and myths, and share personal experiences about receiving the vaccine. But before we begin, there are some items I'd like to go over. The session will be recorded. Everyone is on mute. To turn on captioning, click on the live transcripts at the bottom of the Zoom link. And if you have any questions, please use the Q&A feature, and we will do our best to answer all of your questions. Also, today's conversation will be addressing questions throughout. So if you already have some questions, I would recommend waiting until the latter half of today's discussion, as our panel may have already addressed them in the beginning of today's conversation. Now, let's first get to know our awesome panelists. First, I'd like to have Dr. Saul Jimenez Sandoval introduce himself.
Hi, everyone. I'm Saul Jimenez Sandoval. I'm the interim president of Fresno State, and it's great to join you this afternoon. Thank you.
Thank you. Next, we have Dr. Trinidad Solis.
Hi, good afternoon, everyone. I'm Dr. Trinidad Solis. I'm a public health physician with the Fresno County Department of Public Health, and I'm also a family medicine physician.
Thank you, Dr. Solis. Next, we have David Lucchini.
Hi, David Lucchini. I'm the Assistant Director with the Fresno County Department of Public Health. And then next week, I'll actually be the Interim Director of Public Health. So thanks, everyone, for the invite.
Congrats, David, and thank you. Next, we have Elizabeth Rocha Zuniga.
Thank you. Hi, everyone. Thank you so much for taking the time to be with us today. My name is Elizabeth Rocha Zuniga, and I have the honor and privilege of currently serving as your student body president.
Thank you, Elizabeth. And lastly, we have Dante Bull.
How's it going, everyone? I'm Dante Bull. I'm a senior here at Fresno State. I'm also a student athlete, so I'll be talking to you guys about that portion of it, getting the vaccine. Thank you for having me.
Awesome. Thank you, Dante. And thank you, everyone, for being here today. As a Fresno State student, I cannot wait to return to campus this fall. As we now know, part of this process to return will be receiving our COVID-19 vaccine. And that brings us to our panel today. I'm extremely grateful for Fresno State and Fresno County for coordinating today's discussion. This is an awesome opportunity for us to hear from multiple individuals and engage in a conversation between students, faculty and staff, and county health officials. Fresno State is a community, and I have no doubt that at the end of the day, we all share the common goal of wanting to be safe and return to campus. We also understand that there are a lot of questions surrounding the vaccine. And because of that, our panel wants to be present for you and your concerns. And that brings me to our first portion of today's discussion. I would like to invite David and Dr. Solis for our first question. And that is, can you please provide a general overview of the vaccines and their effectiveness?
Yeah, sure. Great question. And we do have a PowerPoint prepared. So if we can please share the screen for that. Great. Thank you. Alrighty, so I'll be starting us off, and then David Lucchini will also answer parts of this question. So next slide. Okay, so before we talk about the vaccines, I think it's just important to do a little bit of background about the virus that causes COVID-19. So the virus that causes COVID-19 is called SARS-CoV-2. It's a new novel coronavirus that emerged in the world last year. And just so we're all aware, it's natural for viruses to change through mutations that create new strains of the virus. And those are called variants when it changes. And now in our community, there's some variants that are circulating. We've identified several in Fresno County, and it's concerning because these variants are highly contagious and sometimes may cause more severe COVID-19 illness. Next slide. And I wanted to share with you all some data from our Fresno County Department of Public Health. And you can also find this on our website. It's accessible for everyone. This is recently as of last Friday. And it's very concerning because it's showing cases of COVID-19 that they're rising among our young adults in Fresno County. And specifically is relevant for our conversation here because as you can see here, this is from the beginning of the pandemic until April 23rd. The group now that has the most cases of COVID-19 are individuals from 20 to 29, which is, you know, our college age students for the most part. And so it's concerning because likely this is triggered because of variants that are circulating and also lack of vaccinations. I know, you know, our older age groups had early access to the vaccines. And as you can see, 50 to 59, 60 to 69, it's lowering now. Where in the beginning of the pandemic, they were the age group with the higher cases. But now that they've been vaccinated, we're seeing a shift where the younger adults now are the ones in our communities with higher cases of COVID-19. So just wanted to share some actual data from our county reflecting another important reason why we really hope you all get vaccinated. Next slide. And I think it's important to understand just the basics of how these vaccines are made. So for the Pfizer Moderna vaccines, they both utilize the same type of technology. Well, let me back up first. So the COVID-19 virus has spikes around it. And you see that image there on the PowerPoint. It's like a rough visual. So it has spikes around it. And usually this virus uses these spikes to attack your body and enter your cells and infect you. And again, the coronavirus has RNA. It tells your body, hey, make more spikes. And that's how it keeps infecting yourself. So this technology that Pfizer Moderna uses is called mRNA, messenger RNA, and it tells your body how to make the spikes. It doesn't include the whole virus. It's not a live virus. And it pretty much just tells your body, hey, make these spikes, and your body recognizes them as foreign and makes antibodies to them. And that's how these vaccines work. They are now able to recognize the spikes of the actual virus if you were to come in contact with it and kill it. This technology, the mRNA, has been around for years. So it's not something that boom, you know, we just came out last year with it. It's been around for years, and we were able to utilize it with these vaccines. Next slide. And the Johnson & Johnson vaccine, it's a slightly different technology in that it uses a harmless, inactivated cold virus known as adenovirus. And so this virus causes common cold, pink eye, things like that. And it uses it as a viral vector, which means it helps carry, so same idea as the other vaccines in that it helps carry the message or the gene for the coronavirus's spike protein. So that's the little spikes around the virus that can, again, attack your cells and cause infection. So the difference is the way this message is delivered to your body of the spike proteins. This one uses, again, an adenovirus and tells your body, hey, make these proteins, recognize them as foreign, make some antibodies. That way it's prepared to attack if you were to encounter the virus. As you all know in the media, there's been a lot of developments lately with this vaccine. On April 13th, the CDC and FDA recommended a pause because 6 women under the age of 50 developed rare blood clots known as CVST, cerebral venous sinus thrombosis. Some were in the brain, but some of the other clots were in other parts of those women's bodies. And it was in combination with low platelets, which is associated with bleeding. And this happened within 3 weeks of receiving the vaccine. Again, although it's super rare, less than 1 in 1 million chance of having this, the CDC and FDA thought it was so rare that we needed to investigate what's going on, what happened. And so I think it's a great way that it shows you how high these safety standards are that the CDC and FDA have for our country. And so they convened a panel of experts, and they looked over the data and these cases, and they found that it's super rare. And after an extensive safety review, they lifted that pause recently on the 23rd, and they recommended that providers in the communities just advise people of these risks, because we want to be transparent and we want people to know, hey, this happened, and also let providers know if you recognize this, how do you treat it? So again, it's super rare, less than 1 million chance, but yeah, so just wanted to make you aware that this happened. It was a 10-day pause, and the scientists all agreed it was safe to continue. Next slide. And this is just a summary, just to show you the differences that Pfizer and Moderna both require 2 doses of the vaccine. Pfizer is 21 days apart, Moderna is 28. Johnson & Johnson is a 1-dose vaccine. And again, Pfizer is the only one right now that is for 16 years and older. Next slide. And this is a summary that right now, anyone 16 and above is eligible to get the COVID-19 vaccine throughout our county and state and country even. And after getting vaccinated, this is what I really want to hone in. After getting vaccinated, your chances of getting severe illness or dying from COVID are close to 0. This is really powerful. Many other vaccines cannot say this high of a statistic. So that just shows you how effective these vaccines are. And this is for all 3 of them. And another reminder, people are considered fully vaccinated 2 weeks after the 2nd dose of Pfizer or Moderna, or 2 weeks after the single dose Johnson & Johnson. And you know, we have seen some individuals get COVID after their first shot of Pfizer or Moderna. So that's an important reminder not to let your guard down, and you need to complete those 2 doses if you're getting Pfizer or Moderna in order to be fully protected. So just keep that in mind. And again, current evidence shows that COVID-19 vaccines still provide valuable protection against those variants I mentioned earlier in the talk, because they are circulating in our community and we don't want to let our guard down. So just another reason why we should get vaccinated. Next slide. And then David.
So what's really important is making sure we're also doing other things besides vaccine. And so as you've seen throughout this event, the importance of face masks that cover your nose and mouth. Once again, masks are very effective. We've seen over and over to prevent a secondary prevention of transmitting this virus from you getting the virus or you transmitting the virus. So, but what's really important is that you're covering both the nose and mouth. The chin diaper is not effective and your nose out is not effective. So it's really important to wear it over your nose and mouth. Now you can wear cool designs and be cool on campus. That's really cool. Distance, 6 feet. You've heard that over and over, making sure you're keeping that distance, especially indoors. Indoors, it's critical to have that distance as another barrier to prevent the transmission of the vaccine. Washing hands frequently. Of course, that's not with just COVID-19. That's with a lot of germs. Washing hands is a critical step to preventing the spread of not only COVID-19, but other viruses and bacteria that can cause harm to others. And then avoiding large gatherings. Next slide, please. So registering for COVID-19 vaccines, the state of California has come up with the visit myturn.ca.gov to register for a COVID vaccine. So make sure you utilize that system to register for vaccines. And I think you'll also see as the mass vaccine phase goes away, you'll probably see more and more clinics in the county start doing walk-in also. So just be aware and really go to our website. You see the link right there. This website is being updated on a regular basis. So it's very important to stay up to date on what is going on with COVID and how to prevent COVID transmission. So please go to our website on a regular basis. You'll see there not only vaccine updates and vaccine sites, but also testing. Testing is still an important part of this event to make sure that if someone is symptomatic, that they don't have COVID. So it's really critical to continue testing. Next slide. And there are a couple of questions. I'll get to the questions in a bit here. Let me show you, if you've been fully vaccinated, here's kind of the good stuff that we've gotten from the CDC that really lets you do some more things when you're vaccinated. You can go visit inside a home or private setting without a mask with other fully vaccinated people of any age. We've already seen a lot of our grandparents who are getting vaccinated excited now to see their kids or their grandkids again inside a home without a mask once they're fully vaccinated. You could visit inside a home or private setting without a mask with one household of unvaccinated people who are not at risk for severe illness. So that's critical, understanding that you can be vaccinated and go unmasked as long as you have someone who is unvaccinated, who's not at risk for severe illness. And you're looking at age, you're looking at type 2 diabetes, hypertension, lung disease, and other things that can really lead to more severe illness for someone. Travel domestically without a pre or post travel test. That's a thing you can do when you're fully vaccinated. Travel domestically without quarantining after travel. That's huge. Travel internationally without a pre-travel test depending on destination, and traveling internationally without quarantining after travel. Now it's still high risk. Once again, you saw large gatherings. You want to avoid indoors, the large gatherings, because you're going to have more people that are unvaccinated, that you're less than 6 feet. So it's still important to wear a mask, even if you're vaccinated, if you're in a large gathering, especially indoors. Even outdoors, even with the latest information the CDC released today, that if you're fully vaccinated, you can hang outside without a mask, except if you're in large crowds. But otherwise, if you're outside with small groups, you don't have to wear a mask. So that's a huge thing, especially I know those of you who like to go walking or ride a bike or hang out with a couple of friends outside. Get vaccinated. Lets you do a lot more things outside. Next. Now we're going into some of the common myths that we get a lot of questions on COVID-19 vaccine. Next. Nope, next. There we go. Dr. Solis.
Yeah, so I can take this one. So this myth has been circulating around our community and state, and I often hear it from several residents, and the myth is that COVID vaccines can cause infertility. And currently no evidence shows that the vaccines cause infertility. And I wanted to show you a study, if we can do the next slide. That speaks a little bit about a bit more about that. So a few days ago, this study came out from the New England Journal of Medicine, and in the medical world, the New England Journal of Medicine is very well respected, and it's known for its good research and so forth. And so they looked at over 35,000 women from December of last year to February of this year, and they tracked these women who got the COVID vaccine either before or during their pregnancy. So again, this is tied a little bit to, well, it is tied to the infertility part because it shows clearly women can get pregnant after getting that COVID vaccine. And what we found is that because women got the vaccine in different stages of their pregnancy, their first trimester or third trimester, right now they only have results for the third trimester pregnancies, but they're still following the other women. And they saw overall no safety concerns for women vaccinated in the third trimester or for their babies. So actually women can pass on some protection to their babies, because as we know right now, you can't give these vaccines to children or babies. And so because of the findings of the study, the CDC now recommends that pregnant women get the COVID vaccine. And that's a really strong statement during this pandemic, because before, pregnant women weren't included in the initial clinical trials of the vaccine. But that's why this study is so important, because it's showing that overall there's no major safety concerns that they found. And again, 35,000 women, of those, some became pregnant after getting the vaccine. So again, there's no evidence so far showing that there's any causal relationship to infertility. So that is a myth. But there is a lot of evidence showing that having COVID increases chances of miscarriage, stillbirth at high rates. So actually being infected with COVID is, as I've just mentioned, much worse. So again, want to be very clear, this is a myth, and now we're seeing more and more evidence showing that women are becoming pregnant after getting the vaccine. So next slide.
So the other one we get a lot of questions on is about that the mRNA vaccine can change your DNA. So that is total myth. The messenger RNA never even gets into your DNA. The cell takes care of the messenger RNA before it even gets into the nucleus. And so it takes care of that. So there are no risks to any DNA changes. Once again, Dr. Solis had mentioned earlier, this mRNA vaccine has been studied for years and years and years. You're hearing it now because COVID gave an opportunity to utilize this new technology to provide an effective vaccine. It's been shown to be very effective already. And this is also a technology that will be used in other future vaccines that you're going to see. So this is a really critical breakthrough that's going to make it a lot easier to produce vaccines here in the future for future emerging vaccines, or maybe even looking at other types of medical issues like cancer and stuff like that. Next. So yes, if you've already had COVID, it's important to still get vaccinated. One, remember some of those who've had COVID got the original variant. And now Dr. Solis has already talked about, we've seen a lot of emerging variants. So what we've seen in studies with the COVID is that the antibody protection is really short-lived when you get COVID-19. The vaccines have already shown in the Pfizer, at least 90 days. Now the Pfizer studies are showing 6 months, and we expect that to even be longer protection of antibodies. And what's important is the vaccine is even showing more effectiveness with the new variants compared to just natural immunity if you got COVID-19 originally. So this is why the vaccine is another tool that allows you to really protect yourself from these other variants. Now, there's a question on the Q&A I also want to clarify, because there was a question of, it says 0 chance of getting COVID. The 0 was the vaccine's effective on preventing severe illness like hospitalizations or deaths. Not 100% that you can't get COVID. Now with the mRNA vaccines like Pfizer and the Moderna, you're looking at the efficacy of preventing COVID infections in like 90 to 92%. The Johnson & Johnson a little bit lower, more in the 70%, but we're talking again, mild illness. But when you're looking at severe illness and going in the hospital or going in death, that's where they're close to 0 effectiveness. They're excellent. So I want to make sure I clarify that before we end. All right, next one. Now, herd immunity is another one. I've been in public health for 28 years, and this has been a discussion for the longest time is, oh, isn't it better to just get natural immunity for long-term protection? So one, the dangers of herd immunity of just doing natural is, first, you don't know how you're going to react. Certain people are going to get the disease and get a severe reaction. So they may get hospitalized, like we've said, they may die. They may have long-term. You may have heard about long COVID haulers. That means they continue to have symptoms for months and months and months. I have a cousin who's been weeks and weeks with no sense of smell or taste. Can you imagine an Italian guy with no sense of smell or taste for a long time? That's life-changing. You can't smell that pizza. So this is serious. So you take a chance with herd immunity. Second thing, as I mentioned before, the natural immunity with COVID is not showing a long-term success or even very protective with other variants. The vaccine is showing much more protective antibodies for a wide range of the variants, and will also be better to develop the new vaccines. So like Pfizer, Moderna are already working on booster vaccines to deal as more variants get created, because if we don't slow down transmissions, the virus likes to recreate itself, and that will continue as we see outbreaks throughout the world. So we've got to do our best job of reducing the rate of transmission so the virus doesn't recreate itself. So vaccine is a critical tool to slow that down. Next slide. Oh, is that the end? So I'll go back to questions.
Well, thank you very much, both David
Want to hit
and
some of those
Dr.
questions real quick?
Solis. Yes, that's actually just what I was going to move
All right.
to.
Dr. Solis, you ready? Here we go. We're gonna go fast on these. How long does the vaccine stay in your body? And also, what will you do if I get mild illness with COVID? Once I'm vaccinated, I come down with a mild COVID. What do I do if I'm a student in person has COVID? Will the class need to be notified? And does the classroom have to be shut down for the 7 to 10-day quarantine guidelines?
Well, first of all, I would say if you get COVID, then you need to follow the protocol from the CDC saying you need to isolate for 10 days. And again, that means you can transmit the virus to other individuals in your household and so forth. So you gotta isolate, wear the mask, everything we just talked about, the COVID precautions. In terms of the classroom, David, I'm not sure if you have more guidance on that or.
I can actually answer that,
Oh,
Dr. Solis. With the classroom, we would follow our contact tracing that we've received training from the county. And then we will then assess where, what kind of contact happened. If it is widespread contact, then absolutely we're within quarantine at that time. But we would implement the protocols that we have here at Fresno State. I just want to say that within the timeline that this has happened, we have not had any community spread within Fresno State also, because again, we maintain the mask mandate at all times, very, very high hygiene protocols that we have at Fresno State, and also the hands, sanitation, everything else is in place, so.
My mute was stuck, so sorry, I didn't, I was struggling with my mute button. So I want to also explain that this is why vaccines are important. If you're vaccinated and you're asymptomatic, you do not have to quarantine. Okay, so that's another thing that's important to understand. If you're symptomatic, then you need to isolate yourself and all that and get tested. But if you are vaccinated and you get close contact to someone, you do not automatically have to be quarantined. Let me bring up the Q&A. My buttons are starting to hurt, so someone else may have to start doing the questions because it's not popping up. Oh, here's the next question. What proof do we have for claim that we won't get COVID after vaccine? Well, once again, those are studies that the CDC works with the manufacturers. They're always constantly studying. Remember, this is science. So they're always constantly getting data. And so based on the vaccine, the percentages of not getting COVID it's highly likely you won't get the actual COVID. You may get mild illness, but even that is a low chance. Next question, how can we trust a doctor that is only a family physician and not a specialist in this vaccination? Oh, that's an interesting question. So family physicians, I'll let Dr. Solis, you're a family physician.
Yeah, well, I also have a MPH, a Master's in Public Health from Johns Hopkins. It's the top public health school in the country. And so in that curriculum, that's extra years of training where we learn more about epidemiology, and all doctors, regardless of specialty in medical school, learn how to read basic science papers. And so all the material I shared with you, it comes from like a medical background and training. So I just want to reassure everyone I do have the training to share about these vaccine materials.
Here's another good, let me see. If Fresno State is trying to require students to get this vaccine, this may be more for the school, why are masks mandatory?
I think that is a good question if Dr. Saul Jimenez and President can answer that.
Yeah, so masks will be mandatory because we even though you're vaccinated, we will maintain all protocols in the fall for the safety of our students. It's better to be safe than later be sorry. We'll be vaccinated on campus, and even though we'll be vaccinated, we will also wear the mask. Just in case, just as a precautionary measure that we're taking on campus. Dr. Solis, I don't know if you want to answer or add anything to that,
well,
or David?
I was also going to add something too, because remember, the mask is still because we're still trying to get more and more people vaccinated. So you don't have herd immunity. You're seeing the CDC start loosening up on some of the mask requirements outside. But when you're in a classroom indoors, it's still important because remember, we still have these variants. So you could have breakthrough infections. And so until we have a further, higher percentage of people vaccinated, it's tough to get rid of that mask mandate, especially when you're in high risk areas. Dr. Solis?
I think that was a great summary, David, what you said. I don't have much more to add.
We go to the next question. This is a Fresno State question. Luke, am I taking your job or are you supposed to? I feel bad.
David, you're doing a great job, but actually we can save the Fresno State questions for the
Thank you.
latter half of this session.
Let me see if there's any more vaccine questions. I'll just go through real quick.
I
Dave,
do
there-
have a great one right here pulled up.
Go ahead.
We have one attendee who asks, some people think that if they've had COVID, it's riskier to be vaccinated than not. What does the science say about this?
Well, sorry, Dave, were you gonna answer? Or?
No, go ahead.
So in terms of having, the question was if having, is that the vaccine is riskier than having COVID?
The question was, is if they've had COVID, is it risky to then get the vaccine following that?
Okay, so just to clarify, if you've had COVID, it is not risky or riskier to then get the vaccine. As we had discussed earlier, having natural immunity, studies are showing it doesn't last very long. Some studies are showing like up to 90 days, like you can have this natural immunity, but then it wanes off. And as David was saying earlier, the studies are showing that the vaccines are lasting at least 6 months, but probably longer. That's just how long we've been studying them. But I'm sure as the research continues, we'll see that they last longer, maybe even up to a year. But that's why they're also looking into boosters. But just want to clarify again, it's not correct that if you've had COVID and get the vaccine, it's dangerous. That's not true.
I'd like to thank you both, Dr. Solis and David, so much. For me, this means so much to have this personalized data about our community from earlier in your presentation, because there is so much information out there. But really, we have you both, and we're putting a face to the information that we can receive. And that's how we understand that it is credible and that it is true. And moreover, we understand the nuances in our own community and how it specifically relates to us and returning to campus. Because the COVID-19 vaccine requirement will help our campus return to that in-person environment that we so dearly as students loved prior to this pandemic. And David, do you have any closing remarks?
No, Luke, I'd never invite Italians on these panels because I can't shut my mouth. But the reason I want to tell everyone, all the students here, your questions are critical. We need to hear your questions. We understand why sometimes people are nervous to get a new technology or new vaccine. They're not sure. So these are great questions, not only for us, these are important questions to have with your medical provider. We expect that everyone should have a medical home. The one thing I've learned in public health, especially with our youth, we feel like we're always healthy, nothing can hurt us. And it's important to have a medical home, making sure we're having physical exams and having that medical provider you can have these critical conversations with to discuss your health. So I'm going to use this moment to once again take advantage of having a medical home, get physical exams on a regular basis and important screening. I know Janelle oversees the medical clinic over on site, so she knows how important this is. So I want to thank everyone again for those critical and important questions.
And thank you, David and Dr. Solis. And David, just as you mentioned, these questions from our students are super important to this conversation right now. And that is why I would like to now move on to our next segment with both Elizabeth and Dante and ask them some questions and gain their perspective about the vaccine. So first, if we have Elizabeth give her perspective on the question, and then Dante, if you wouldn't mind following up. The first question I have for you both is, what was your experience with the vaccine and why did you choose to receive it?
Thank you, Luca, for that question. So my personal experience, for some reason, I think needles are very intimidating, but I'm still trying to figure that out as to why that is. However, I personally felt comfortable getting the vaccine. Seeing the research helped me feel reassured in its effectiveness, and my trust in the science definitely played a role in deciding to receive the vaccine. So right when I learned from all my colleagues in ASI that we had the chance to get the vaccine in early March, I did, especially because of how easy the process was to register on my turn and how accessible the vaccine was here in Fresno County. So my appointment, I had my appointment at the fairgrounds and I got the Pfizer vaccine. And for some reason, my first dose had slightly more side effects. than the second dose, which was kind of strange because I feel like it's usually the opposite. But my side effects were more fatigue, soreness, and mild headaches. But I thought that was very interesting that my second dose was not as like intense as everyone has made it to be. I have heard that some of my friends actually had side effects hit them hard in the second dose, but also I have had friends that had no side effects at all. So from my perspective, getting the vaccine, I decided to get the vaccine because I felt like I needed to feel secure in visiting my family and seeing my loved ones as well. And so I really wanted to get to that back to normal, whatever that may look like, because I'm socializing. I miss going to events as well. And so being a part of herd immunity was definitely a reason why I decided to get the vaccine. Thank you.
Great response. Yes, I mean, I identify with every single one of those sentiments. Dante, how about yourself? How can you share or how was your experience with the vaccine and why did you choose to receive it?
So my personal experience was pretty smooth. I didn't really have any complications or any of the side effects after the first or second dose. My personal reasoning for me was being a student athlete. There was so much protocol we went through this fall of having to get tested 3 to 5 times a week, having to screen every morning, having so many complications, and just making our day about 35 to 45 minutes longer at 6 in the morning just made it difficult. And if we start to get vaccinated as a team and as a community together, we can build that environment where it makes it easier for us to get to somewhat back to normal. And that was super important for me because me being vaccinated takes away and minimizes my opportunity to miss and competing in my sport, which is right now is my job. So football, I take it as my job, and any opportunity I can have to make sure I keep that job and keep safe in that environment is super important to me.
Absolutely. And I can just say I miss going to football games. I want tailgate season to return. So I completely agree with you there. My next question for you both, and Elizabeth, I'll have you start out with your response. What advice would you give to someone who is hesitant about getting their vaccine?
Thank you for that question. I'm a big believer in definitely validating anyone's feelings about the vaccine. So I hear you. So I would say, in my perspective, to think about your safety and your health, your loved ones, and most importantly, think about the folks who have an increased risk for severe illness from COVID-19, and that we're all in this together. And now with new guidelines, folks who have been fully vaccinated no longer need to wear a mask outdoors except in certain crowded settings and venues. That's like a right step in the right direction that I hope that we all would want to be a part of if you, of course, are able to and feel comfortable. That's my advice, I guess. Thank you.
Awesome advice. And Dante, how about you? What would your advice be for someone who feels a little bit hesitant about getting their vaccine?
I feel that everyone should really take it into their own hands, and like this is your life, like you have the choice to do whatever you want. But I feel like instead of listening to what other people have to say, you should really take your own time. Like, don't listen to social media. Like, the doctors here are giving us great information, and that's great because it's coming from a very pure source. But instead of being there and listening to the propaganda and the negative things that are coming from social media, you should really take your own time if you want to get the vaccine, to do your own research and have a proper understanding before you make your own decision. And I talked to some of the guys on my team because a lot of guys were stressing out about it. And I made the point that I was one of the first 10 guys in our team to do it, just because I wanted to show that it's going to be okay and it's going to benefit us in a way. So I would say just stay calm, do your research, and it'll all be all right.
Excellent point. And to build off of that, I'd just like to again thank all of our attendees because they are taking your advice, Dante. I mean, we're so lucky to not only have you and Elizabeth here, but to also have Dr. Solis and David, and then President Jimenez Sandoval with us. We're just getting a wealth of different perspectives and views about true, credible information regarding this vaccine. And that brings me to our third and last portion of today's conversation with Dr. Saul Jimenez Sandoval. And my question for you is, what can you share with us about the CSU Chancellor's announcement about the vaccine being mandated upon FDA approval?
Yeah, thank you, Luca, for that question. So as you know, and as we all know, COVID has really highlighted our need to be patient because not all the information is there at the same time. And sometimes the information has to be reassessed, as we go along. So I'm going to ask you for a little bit of patience on these fine-tuning type of details that we'll have as far as the mandate for a vaccine in fall 2021. Right now, committee continues to work on the development of this system-wide policy based on state and federal guidelines. This committee will examine enforcement. It'll examine exceptions, everything else. And then once they do have all of that, and once it does go through the Chancellor's office, we will then make that information available to you. As you know, both the CSU and the UC system together addressed this issue and also made it so that vaccine will be a mandate for fall 2021 repopulation. So both systems, which are the biggest in the country, essentially, will be requiring this vaccine for fall 2021. But more info will come later on, and as soon as it comes out, then I will make it available to you. Check your Fresno State email, and of course, we will also publish it through our social media channels.
Thank you, President. And I had seen this question pop up a few times in our chat throughout this session, and I believe you already kind of touched on it. So I just would like you to reiterate, if you can, will there be any exceptions made for medical or religious reasons? Absolutely.
So by law, exceptions are made on vaccines based on religious reasons and also on medical reasons as well. These are the two exceptions that I'm very confident will be followed as far as the vaccine mandate is for fall 2021.
Great. And another question that I saw quite often in our chat was, will online courses still be available if students do not want to get the vaccine?
So that depends, and it depends on many things, Luca, because there are certain disciplines and there are certain classes within certain disciplines that simply cannot be taught virtually. Some of these include labs, some others include the arts, others include nursing, for example, and some of these classes have to be taught face-to-face. We are planning to have approximately 30% of our classes virtual, and we hope that this 30% will then meet the demand. We'll have sort of like the medium sort of like repopulation in the fall of 2021. Come spring 2022 though, and then fall of 2022, we do expect to be back to normal on campus by fall 2022. So I do encourage the students to, very highly encourage them to get the vaccine. It's really the safest and most secure way of repopulating the campus and really keeping our community safe. It's really not about me, it's about others in this case. How do I come together for the sake of my neighbors, my family, my friends, so that we can all be a safer community together?
Absolutely. And just discussing this wonderful and exciting return to campus, another question that I saw was regarding what would safety requirements look like for fall semester for students who are planning to return in person?
Sure, yeah, and another issue that has really researched during this time is that university education, it's not about a paper that says diploma with your name on it. And it's not really about the knowledge that you get. Those two elements are very, very important, of course, because they prepare you professionally for the world. But like fundamentally at the core of it all, it's the experience of being here with each other. It's the experience of dialoguing with your fellow students, of dialoguing with your professor in the hall, of just having these informal conversations that really add a lot of value to what the university experience is all about. So with that in mind, then we do plan to have the daily health screenings. We do plan to have the temperature checks, and we also do plan to require the face coverings as well. We are taking great strides in maintaining our environment as safe and as clean as possible. The CSU Mechanical Review Board, for example, has assessed guidance from the CDC and the American Society of Heating, Refrigerating, and Air Conditioning Engineers, and has developed a list of recommendations that our campus has implemented fully here at Fresno State. So, this goes through the air conditioning system, through the filtering system, through cleaning the classrooms and making sure that everything is fine, and also maintaining humidity between 40 and 60%, because the research suggests that viruses do not live and grow well within this range of humidity. So we're taking great strides and great efforts in really maintaining a safe environment within Fresno State. Of course, at the same time, we will maintain the health screenings, and we'll maintain also the temperature checks and also the masks. I think the masks, as you heard, Dave Lucchini and also Dr. Solis, are fundamental in keeping each other safe during this time.
Absolutely. And I made sure to gear up on my own masks. I've got some superhero themed ones. I'm ready to sport my mask and color coordinate. I'm excited. I am ready to get back on campus.
That's great.
And we just had another question from an attendee that actually touches on one of your previous answers. Now, you mentioned that, I believe, if this is correct, 30% of classes will still possibly be virtual. How can a student check which classes are virtual through their student portal?
Again, I'm going to ask you for a little bit of patience on that. We are working through that as we speak. And then once we get the full guidance from the CSU on, how do we implement the vaccine mandate and everything else, we will have all of these details as we go along. Right now, you cannot tell whether a class is virtual or a class is face-to-face because they all look the same, but we will start to roll out small details, as we get them planned out. The chairs are working on this, the deans are working on this as well, and also the provost is working very hard to make sure that we have classes that really speak to us spreading them out throughout the curriculum, so that we can be ready for these situations in the future. I know that it's convenient to be virtual, because you just click on and then you're on from anywhere basically in the world. But at the same time, I really want to focus and really emphasize how important it is to be together for the experience of learning together, for the experience of actually forming that cohort, that unity, that cohesion as a group that we have when we're in a classroom. That is the power of Fresno State. The power of Fresno State is that we bring people together, we think incredible things together, and then later on, you go on to become incredible professionals in our communities that really uplift the quality of life for everyone in the Valley. So it's really all about what the experience of the university is going to be all about in fall 2021.
Absolutely. And with all of this wonderful developing information that you guys are working so hard to provide for us students, where can I go to seek that out from day to day if I just want to see if there are any new updates?
We have a webpage with new updates specific to the COVID-19. You can just put COVID-19 Fresno State and it'll bring up the webpage. I'm sure that we can also put it in the chat right now. But that is really the latest that we have. And again, check your Fresno State email, because that's really the main way that we communicate with you. And I'm trying to give you the best information with not a lot of paragraphs, because I know that most students will not read a very long message that has 6 or 7 paragraphs about this big, right? So I'm trying to really fine tune my communication style with you, so that you see it and you get the main points, and then you go on with your lives. So that's we'll make sure that that's there as well.
Thank you so much. And guilty as charged. I really appreciate
I'm guilty as charged too, Luca. Me too.
If there's one thing with all of this virtual atmosphere, it's been a lot of emails. So the direct communication is so appreciated and
That's
so,
right.
so helpful. I have one more question before we move on to closing remarks. And that's in regards to specifically if classes that are in person, will there be any hybrid models of some of the students being virtual or some of the class sessions being virtual? Could you explain if there's anything yet on that?
Sure. Yeah, we're trying to be as flexible as possible with our students. We do have the hybrid model. We have the HyFlex classrooms that are now at Fresno State. We have 50 of those classrooms here. I know that our team has been really focused on getting that ready for fall 2021, and Vice President Leon is in charge of that. But both the provost and Vice President Astone have really been focusing on this approach on 50 HyFlex classrooms, where it could be that, let's say 60% or 50% of the students are in person, and then the other students, for various COVID-19 related reasons, will be virtual. In this case, then, I have seen the classroom myself. It's a really cool setup in which you have the camera on the professor. That's what you see, if you're virtual. And then if you want to participate, you participate just normally. You unmute, you speak into your computer or your device, and then the classroom will have these for some reason I was thinking of it in Spanish, these altoparlantes, these bocinas, these speakers. Thank you, Elizabeth. This hardly ever happens to me, but today I've been speaking Spanish throughout the day because I've been doing interviews, so my mind is in Spanish. So these speakers in the classroom that really, it's a very clear voice that comes out sort of like, out of the speaker, and then you're able to hear it, you're able to interact. So we're trying to create as natural as possible the classroom environment for our fall 2021.
That sounds very impressive, both in Spanish and in English. I want to try that now.
Yeah, that's what happens, Luca, when you have 2 interviews with Univision, right before this session.
What can we say? You are a busy man, President. We thank you so much for your time here today with us. And with that, I would like to invite you to present your closing remarks for everyone here who has attended our panel today.
I just want to thank all the participants and all the panelists. I want to thank all the students who logged in and had their questions. It's great that Dante and also Elizabeth were here to present their perspective from the student side. But it's really impressive, that we have Dave Lucchini, such an incredible, important, very knowledgeable individual in our community, as well as such a well-trained, highly professional doctor like Dr. Trinidad Solis. So I'm grateful for their knowledge. I'm grateful for promoting the health of our environment, of our community overall. And I really want to strongly encourage our students, our faculty and staff to get their vaccines before fall 2021. I know that there was a question about, what if the vaccine is not approved, by August? I asked that question myself, and we are expecting the vaccine to be fully approved by the end of May. So we will have plenty of time before August hits when that happens. As new information becomes available, absolutely, we will communicate it to you via your Fresno State email. So please check that, and also our social media as well. And last but not least, I really want to congratulate the class of 2021. I know that President Rocha Zuniga is going to graduate. She has incredible plans ahead of her. I'm sure she's going to become this incredible professional. But that's really the model, that we all follow, right? That's why we're here, to really empower you to continue on with your career later on. I want to leave you with one thought: keep the focus on the prize. Keep the focus on finishing that Fresno State degree, because that's going to be your passport to a great life, and also it's going to be your passport to giving back to your community. So with that, have a great day, and again, congratulations to our graduates of 2021. Thank you, Luca, for moderating as well.
Thank you. It was my pleasure. It was an honor. Thank you so much, President. And thank you for everyone who has attended today's conversation. I just want to thank all of those who were on our panel as well, from both Elizabeth and Dante to David and Dr. Solis, and of course, President Jimenez Sandoval. For those who had asked or may have came in late, do not worry. This was recorded and it will